Heat stroke. This life-threatening condition, characterized by a dangerously elevated core body temperature, specifically exceeding 41 degrees Celsius or 108.5 degrees Fahrenheit in dogs, often presents with signs of central nervous system dysfunction. Extreme overheating sets off a cascade of damage throughout the body's tissues, leading to a variety of clinical and pathological syndromes with differing degrees of severity and rates of progression. Despite our best efforts with whole-body cooling and intensive supportive care, heat stroke in both humans and dogs remains highly fatal, with mortality rates sometimes exceeding 50%. Improving the outcomes for these patients hinges on early diagnosis, the identification of secondary complications, and prompt intervention. One of the significant complications observed in over half of dogs suffering from naturally occurring heat stroke is a condition called disseminated intravascular coagulation, often referred to as DIC. This serious condition is strongly linked to a higher risk of death. Post-mortem examinations of dogs that succumb to heat stroke have revealed tissue damage consistent with disseminated intravascular coagulation, including injury to the lining of blood vessels, neutrophilic inflammation, widespread cell death, and the formation of small blood clots along with a tendency to hemorrhage. While standard blood tests that measure clotting factors and platelet counts are crucial in diagnosing disseminated intravascular coagulation, these tests might not always provide a complete picture of the overall hemostatic, or blood clotting, process. They may not fully assist in making immediate treatment decisions, such as whether to administer fresh frozen plasma or anticoagulants, especially in the early stages of disseminated intravascular coagulation when it might be hypercoagulable and not yet overtly apparent. Viscoelastic tests, like thromboelastometry, offer a more comprehensive assessment of global hemostasis. Conclusion: this study demonstrates that thromboelastometry, particularly the intrinsic assay, is a useful tool for evaluating the coagulation status of dogs with heat stroke. The finding that hypocoagulability, as determined by the area under the curve on intrinsic thromboelastometry, is linked to a worse prognosis and a higher likelihood of developing disseminated intravascular coagulation and acute kidney injury underscores its potential clinical value in managing this challenging condition.